today's webinar on workforce management, the intersection strategy. My name is Michael Maher, and thank you for joining me. As most of you know, I am the CEO of the Aged Care Development Network, ACDN. We provide workforce accreditation services for the aged, community and disability sectors, as well as an actual membership organisation for the workers in those sectors, supporting them with career pathway information, education opportunities, and member awards. Anyway, in my role, I have the opportunity to work with and within a large variety of aged and community care providers across Australia, small, medium and large, public, private and non-profit. As I get around the sector, I'm always looking at ways that can support managers to help them simplify the work role in workforce management. So if you're on this webinar, I would guess that you have an interest in that topic. That's the big picture. And as we go, if you'd like to add in chat, even now, the little picture, what are your headaches? What are your challenges? Anything that you want to send through that I can ask about or talk about, make sure that I've covered by the end is always helpful. On the webinar this morning, one of the main ones came through is about how do we build culture, recruitment strategies. The only technology we use is payroll, everything else is manual. How do we make the first step? So there's some of the challenges that got thrown up this morning. So if you have any that you'd like to add in, just add them through the chat function at the bottom of the screen. So today's agenda, I'd like to give you an overview of what we're going through over the next 50 minutes or so. This webinar will focus first on innovation in workforce management, a few things that have been happening over the past couple of weeks. And then we'll move into the actual intersection strategy itself. I'll give you a few, one or two case studies that I've worked with. And after that, I'll show you how you can find more information and assistance on this topic if you need it. I value your time and I hope you value mine. So I have a gift that I will announce at the end for everyone who stays with me until the end of the webinar. It is one of the most sought after items in my collection. We get phone calls from strangers trying to get this gift out of us. So it's well worth waiting for. So, as we all know, aged care is going through a rapid change in many ways. Not only is the numbers of users of the services growing with the onset of the baby boomers, but we are professionalising. We're moving from a cottage industry to a professional sector. I remember the old primary school where I grew up being converted into a nursing home back in the early 1980s, staffed predominantly by a few nurses and a large pool of volunteers, mainly who were mothers between 9 AM and 3 PM. There was no group called it carers or AINs at that stage, and the Certificate 3 in aged care was still 2 decades away. The majority of companies that operated nursing homes were either church or community-owned non-profit providers. That was the norm. We're not the first industry to professionalise in this way, and I'm sure that we won't be the last either. From research, this process happened in other industries over the last 100 years. There are certain characteristics that come with this change. For example, as an industry professionalises, so does its workforce. When a workforce professionalises, there is a lot of expectation by both the members of that workforce and the community of certain standards. This is where the membership bodies, CPA, Certifying Practicing Accountants, the Law Society and Engineers Australia came from. They were created to maintain standards for the people who work in those industries, providing accreditation to the people who meet those standards. CPA, the Law Society, and Engineers Australia are not controlled by the government. They set benchmarks for what is expected by way of education, quality, and services for the practitioners of that service. For example, as an accountant, you don't have to be a certified practicing accountant, but the government recognises the status of being a CPA and made a rule that all audited accounts must be signed off by a CPA. When you graduate with a law degree, you're still not allowed to practice law. You must first register with the Law Society and tick all of their boxes to be admitted as a solicitor. Once admitted, you can then resign from the Law Society and not receive access to their professional development suite and then their monthly newsletter, etc. But you stay on their books as an accredited solicitor. Engineers Australia provides similar structure and standards to its fraternity. Our industry is now coming of age and needing that structure, those standards around workforce accreditation. Therefore, last week in Sydney, I attended a series of meetings with innovative leaders from across the sector, from private and non-profit providers, including Salvation Army, Aged Care Plus, Summit Care, Ality, Opal, Blue Cross, Bupa, Peak Bodies, AXA, and the Aged Care Guild, and the IT and Aged Care Council. I was also involved in teleconferences with Wesley Mission Queensland, Brightwater in WA, and Group Homes Australia. The ground has definitely been broken on a new workforce accreditation body that will monitor a series of workforce accreditation standards. There's a team of experienced industry leaders working on the standards. Leaders are interviewing potential inaugural board members for this organisation. It is an exciting time to be in aged care, and especially in workforce management. By aged care, I mean community and disability support as well. It is an exciting time. But let's move on to the topic, because it has bearing on what I just talked about. The group working on both the workforce accreditation body in general and the standards to go with that in particular are using something called the intersection strategy. Time after time, we've found this strategy to be the key to success in both planning and executing workforce accreditation. Workforce issues can be put into one of three categories. Any workforce management setup which is inefficient or non-compliant has a problem in one or more of these three areas: people, processes, or technology. To have the most efficient compliant workforce management setup possible, it's essential to look at each of these areas separately and ensure that each of them independently are providing your organisation with the operational support and business intelligence that is required. As getting all the three working together will create exponential growth in a positive way, so will only getting two or three of them together create exponential negative growth. So 1 + 1 - 1 equals 0.5. Let me get into how that works. You can have great people and modern technology, but if your processes are poor, you likely have to do some things manually, which results in an inefficient workforce management operation with high delivery costs. There are often high error rates in these situations because the processes aren't rigorous enough to identify potential errors when they come up. On the other hand, if you have solid processes and great people but have poor technology, you're probably suffering from poor governance because you don't have the technology to run comprehensive reporting that gives you a true picture of your operation. If you have modern technology and solid processes, but you don't have good people, this is often the most high risk and expensive of the pairs for many reasons. Predominantly, if your team isn't focused on quality control, you're going to have a high error rate, which can expose the business to risk in a variety of areas. If two or more of these areas are substandard, you can have a combination of these problems in managing a workforce that typically puts the business at both financial and/or compliance risk. But when you get all three areas operating efficiently, the organisation will save time, save money, and lower risk. That is because the exponential effect here is that 1 + 1 + 1 doesn't equal 3. It equals 5. Now I want to go into a case study from a group we've been working with for a number of years. So we were brought into the group when it had 8 facilities. Those 8 have been brought together into the group from various previous owners. So every home had different processes, cultures, and technology. One of the facilities even had a bit of a facility manager cult running. She could do no wrong, and the problems that it caused. The group had no regular RTO delivered education opportunities for workers. Mandatory training was all over the place, as it was always put back on each site to deliver their own face-to-face. There was no standardised. Sometimes when I was meeting the facility manager at one of their sites, she'd run in after delivering mandatory training and say, "Just hang on a sec, Michael, while I write these down." She'd open an Excel spreadsheet and copy down the list of names on the piece of paper in her hand and save it to her desktop. The personnel records were all paper-based and varied from good to awful between the homes. Some files were 2 inches thick with no dividers, and everything was just chucked into the folder as it was collected. There was certainly no HR technology platform. Most homes had a high turnover, and those homes also had a bad culture. Not surprising. The 2 homes with a low turnover had the best cultures in the group. At one of those sites, while we were there conducting a gap analysis review of personnel records, the staff actually formed a line out of the door to discuss their education opportunities. They were all so excited about this new opportunity that the facility manager had told them about at the staff meeting. When that facility manager went on maternity leave, a locum Don that we know called me and said she filled in. She was amazed at the change of culture in the facility. She actually had to implement a project system for people who went through the training, where she'd get 2 or 3 carers working together on small projects on top of their other work. There was no rank given, there was no extra pay. It was just recognition, or you're one of my guys. You've done this extra training in aged care or disability or leisure and health. I've got this little project that I think you guys could work on. It was chalk and cheese to their action at the worst site, which had the worst personnel records and culture as well. As an aside, that facility manager I just talked about, she's moved twice now, and she calls us whenever she gets to a new facility, and now she's even out of that group, asking me to bring in my team to help her build her team. But back to the group. Each quarter, the HR manager would contact me and ask for a report on how many staff had attended training, how much government funding the group had accessed through that quarter, how their turnover was going this year compared to last year, because we were doing annual HR audits for them, as well as other business intelligence. So, summing it up, there was absolutely no strategy at this place. There was no team building, so there was no care factor amongst staff. Education was nothing more than the bare minimum of mandatory training. So there was a lack of pride and confidence, and lack of literal skills in many areas. That one's an interesting one. A lot of people get caught up on the education bit as just a way of upskilling people. It's not. Half of the purpose is upskilling, the other half is pride and confidence building. Thirdly, the facility manager and clinical care manager wasted so much time each day on manual processes and manual data entry, so they were stuck in the office being managers rather than being out on the floor being leaders. Next, there were mistakes happening across all sites as the manual process hid mistakes. There were no compliances, and there were many non-compliances in Standard 1.6 due to poorly kept personnel records. There was no real business intelligence beyond the data that we supplied to the HR manager, so many decisions were made by gut feel. Never a great way to do it. And even though they had clusters of homes, they could not share staff because the cultures and expectations were so different between the facilities. So the staff refused to work anywhere else but their main employer, but their main home. It really was an eye-opener to work with this group and be able to slowly turn the corner for them. First by working in each home individually before bringing them into a group alignment. And what we did was use the intersection strategy. So let's have a look at the quick overview of the 3 areas that make up the strategy, starting with people. Without the right people in your team, it is impossible to really operate an efficient and compliant organisation. Good people are hard to find, and well thought out recruitment is the key to getting the right people through the door. The best people are qualified with the correct qualification for their role. Not just the clinical roles, but the admin, management, domestic, and cook team all need their base qualifications, as well as access to continuing professional development, CPD. I regularly see support workers who completed their qualification over 10 years ago and have not completed any further formal upskilling in their field since. They are using information and practice that is now out of date and thus puts the customers and the organisation at risk. Although legislation and clinical best practice changes each year, CPD is often delivered in-house by non-qualified trainers. This means that the organisations are often doing exactly the same thing they did 5 years ago, 10 years ago. Yet, when good people are on site, you clearly see a significant reduction in wasted time and costs, all with minimal manual intervention. This type of strategy not only ultimately reduces risk, but it also provides increased meaningful management information to the HR team and wider organisation to better workforce management. You might have a people problem if your staff turnover is higher than 15% per annum, or conversely, you have no staff turnover with people with service over 10 years. I've been in places where they had very little staff turnover, and everyone had been there over 20 to 30 years, and they developed a group of gangs that ran the place. That was an interesting sight. And so the third one is the problem there. You struggle to keep new workers because though there was no staff turnover, people had been there for a while, they bullied the new people out the door whenever they came. Same as they stymied innovation. And one of the key factors to look for is the majority of your staff have not completed formal training for 3 or more years. The second step in the great intersection strategy is processes. Contrary to popular opinion regarding workforce management, it's a lot more than just keeping the personnel records up to date. A workforce management process should be designed carefully and consider risk, efficiency, and governance when doing so. If your processes aren't carefully planned and structured, the best people and technology won't provide you with the workforce outcomes you're looking for. So you might have a process problem if your personnel records are paper-based, because that means on top of things, data is being handled more than once. Many spreadsheets are used throughout the workforce management process. Haven't we seen that time and time again? And there are personnel documents lying around the office waiting for filing. The final stage of the intersection strategy is technology. This sector is all levels of technology usage. As we get around through the providers, we go from very little to a lot. From providers who the only technology to have is a payroll system, through to large multi-function platforms supplied by global players, and everything in between. These days, technology is being developed at a rate unlike that ever seen before. There are always ways to improve your technology setup. I don't care how big you are, there are always ways to improve your technology setup because it changes so quickly. There are now workforce management systems that are 100% cloud-based with zero installation at your premises, as well as automation and connectivity between services and between platforms that allow for entering a piece of data once, and all of the connected systems, payroll to rostering, etc., gets updated straight away. Let alone the rise of handheld devices for both workforce and customer management in real time. So, you might have an IT problem if it is difficult to make changes to your IT system. Nowadays, due to the internet and the APIs, you can really have a best-of-breed network where you can plug and play exactly what you want. And if something no longer performs, you can pull it out and plug in the next thing. You can't get a meaningful report from your system. Again, I still meet providers who none of their technology talks. A key one being recently, we can print a report from our call bell register, and we want to see which staff members were all over 10 minutes in response, but we can't compare the call bell register against the rostering system because they don't talk. So you've got to be able to solve that. Thirdly, the IT department are in charge of which platforms you can use. Again, the IT department it should not be in charge of these things. They should make sure that the computers work. Nowadays, with cloud-based technology, you might have a small four-man team, payroll, HR, education, and there might only be 3 or 4 people in it, and they can download a cloud-based platform that's $10 per user per month, and they can make their department run so much easier, and it's got nothing to do with installation into the hardware and all those kind of things. So it should be outside the IT department these days. Fourth, you're rekeying data into multiple systems. Again, APIs should allow you to put someone into the HR system when they start work. That automatically sets them up in payroll, which automatically puts them on the rostering system. If you're not doing that, you're missing out. And finally, it is difficult to run reports that draw data from multiple systems into one report. Now, these three all work together because by integrating people, processes, and technology, it actually hits another intersection of compliance and efficiency. Does anyone know where this crossing is, where this meeting of compliance and efficiency on the picture is? If you know where it is, put it in chat, please. I'll give you a clue. It's in Japan. So getting workforce management right and conducting in the most cost-efficient manner is a balancing act, but it is doable. To ensure the right level of compliance and efficiency in workforce management, a review of processes, staff, documentation, governance, and risk is often needed. Alan, more information than Tokyo, mate. Let's go down to it's a famous crossing. So an effective workforce management operation mitigates risk of regulatory fines because you have the right people in the right roles. It ensures a happy workforce because they feel valued by their employer. It provides critical management information to the business. It provides cost-effective internal services, is proactive, reliable, and trusted. Too often in our industry, we find employers of all sizes using a very manual and disjointed process for recording information, usually struggling to generate reports for required legislation, let alone creating any business intelligence that provides value to the organisation at large. Yet when the combinations of the right people, processes, and technology are involved, they have a huge impact in a wide variety of ways, not only upon the workforce aspects of the business, but the business at large. Compliance is conforming to relevant legislation and regulations for the sector. In some cases, the consequences of not being compliant can be monetary fines or a time-consuming audit by the agency. Don't we all love an unannounced visit? This could also lead to much more significant fines and ultimately sanctions against the business. Efficiency is about getting the job done with minimum of effort, resources, and cost. Efficiency can refer to the size of the team, the processes they undertake, what manual tasks are completed, what technology is used, and whether there is double handling of information required in reaching the desired outcome. So compliance and efficiency interact in such a way that if you only focus on having the most efficient, fast, and cost-effective operation possible, it could be undermining or detrimental to the quality of the processes and outputs, and thus compliance. But if you only focus on compliance, you could over-engineer your processes so that much of it is significantly increased in the cost of overheads of the operation. Yes, it is Shibuya Station. So let's have a look at efficiency. Efficiency isn't a destination, it's an ongoing journey. But everyone who has anything to do with workforce management needs to have efficiency in mind. Workforce management is often left out of conversations regarding continuous improvement because in aged care it is thought to be impossible because of two industry beliefs. Firstly, that it is so rigid from a regulatory perspective, and secondly, because so many in management have given up hope on the idea of quality staff and just settle for any staff. So between those two beliefs, there's little you can do to gain efficiencies. But the fact is that most workforce management operations are running exactly are running in exactly the same way as they did a decade or more ago. Technology might have been updated, but the chances of the processes being used by the majority of providers having been redesigned to support a more efficient process are fairly slim. As I move around the industry, I always ask how much various workforce management roles cost. I'm always surprised at how many managers who do not know the cost of hiring a new support worker. About 1 in 3 will have calculated the costs at each stage. The ones who don't know usually grossly underestimate and are surprised when I tell them that the average cost, not including induction, training, budding, etc., just the recruitment of a new support worker is calculated at between $1,500 and $2,000. Obviously, the two major costs in workforce management are staff salaries and technology. The trend over the past few years is that the larger organizations get, the more likely they are to invest in technology that allows for efficiencies in workforce management. This makes perfect sense, as even small efficiency benefits become material over a large employee population. But you don't need to have hundreds or thousands of employees on your payroll to see the benefits of technology on workforce management efficiency. And it's not just recruitment, rostering and payroll processing where technology can make a difference to the efficiency in an organization. Very often, if workforce data is being used well in an organization, efficiencies in the operation turn workforce management information into business intelligence. This means that because it takes fewer hours for the HR managers to complete common HR tasks, the more time they have for analysis to understand what is happening to the employee population and relaying that information to managers who can use it to make informed business decisions. From this, efficiencies in rostering processes, agency usage, annual leave, promotions, and other workforce management tasks can be gained. However, as Bill says in the quote, just throwing technology at a problem without understanding how the technology works and the process involved will not magically allow for efficiencies in the operation. So, how do you gain efficiencies? Firstly, you need to streamline and standardize systems and processes. Having multiple locations with different workforce management processes is guaranteed to give you an inefficient process that is likely to be at high risk of errors. The most efficient workforce management operations have a streamlined and standardized HR process, so no matter how many locations or employees are involved. Secondly, continuous improvement. The kryptonite of efficiency is the "we do what we've always done" attitude, and this is prevalent in HR departments across Australia. The phrase that concerns me most when talking to a CEO or Director of People and Culture about HR is when they say, "We're okay. Margaret has been doing our HR for the last 17 years." That sends shivers down my spine, as the chances are that Margaret is doing things in a pretty similar manner as she did almost 2 decades ago. The key to ensuring you have the most efficient workforce management process possible is a continuous improvement program. You need people on your team that are always looking to improve the efficiency of the HR operation, as well as the value it brings to the organization in business intelligence and reporting. Technology. If you can dream it, it seems that technologists can build it these days. The challenges are around understanding what is out there, so as you don't know what you don't know. Between HR, payroll, rostering, recruitment, police checks, reference checks, medical checks, there is a lot of functionality out there, but it can be hard to determine which provider will work best for your organization. Self-service. Many of the first and best functioning mobile payment apps came out of Central Africa. Why? Because necessity is the mother of invention. Many people living there did not have access to a computer, let alone a computer with the internet. But they all had access to mobile phones. Many people worked in the city for 4 days, then spent 4 days traveling back to their village to hand over the money to their family before returning to the city to work again in order to make more money. So mobile finance apps allow them to transfer money without having to spend 4 days on the road. Many workers in our industry might not have computer and or internet access at home, but they all have mobile phones. Unless there's a really good reason not to, all employers should be looking to use an employee self-service portal in their workforce management operation. Some of the biggest hurdles to an efficient HR operation is the amount of manual paperwork, forms, data entry that has to happen from recruitment, personnel records, payroll, and rostering. Self-service portals can help to reduce or eliminate this. If you can afford it, it makes sense not to have two people. If you can avoid it, it makes sense not to have two people complete the same task. Allowing managers and staff to enter details and data at the source means that the various departments that come under workforce management only need to check the information, not rekey it. This means a reduction in the chance of manual data error, as well as taking less time to complete the task. Processes. Processes are the key part to ensuring your workforce management operation is working at its efficient best. The first thing you should do is understand the steps in your process, map them, and then compare them to what actually happens. Having completed this process over 100 times, I often find at this point that when a HR team verbalizes the process, it's not the same as when they actually do it. They will often skip over manual tasks that they complete out of habit and leave them out of the documented process. They tend to simplify the process, and it's not until it's questioned that you end up getting an accurate view of what actually happens. Now, each step needs to be examined for efficiency. Is it in the right place? Are there ways to automate it? What manual tasks are being completed? Is there a double handling of data? What data is being moved in or out of a spreadsheet? How are reports run and delivered? How much time does each task take? Can information be shared electronically? Look to simplify, standardize, and automate any steps possible. At the very least, HR departments should analyze their current operation annually to identify efficiency gains. You may find efficiencies in the form of time or cost savings, as well as ways of providing better business intelligence to the organization. Measure efficiency. As with any efficiency conversation, if you're going to improve, you need to measure. It's one of my mentors used to say, what gets measured gets done. So as part of your continuous improvement processes, make sure that your workforce management efficiency and costs are being measured and benchmarked regularly. The last one's automation. I'm always surprised at how many people don't automate any functionality in aged care. Finally, a key to gaining efficiency in your workforce management function is to automate processes where possible. Automation benefits the operation in 3 key ways. Firstly, automating any processes that are currently being managed manually will provide time savings and therefore cost savings for organizations. In modern times, technology is cheaper than wages, so it makes sense to use as much technology as possible if you wish to manage costs and improve efficiency. Secondly, using technology and automation will provide much more consistent outcomes than manual processes. This can also give organizations certainty around budgets and forecasting for both recruitment and workforce management. And lastly, with the processes automated with consistent processes, the opportunity for manual error is significantly reduced. This means that the percentage of workforce-related errors should reduce, and it also reduces the opportunity for governance issues and fraud. Now, the partner to efficiency is compliance. But how do you ensure compliance? The key to workforce compliance is the ability to understand how the different federal and state legislation work together and where one trumps the other, as well as where the aged care sector's act, standards, and principles fit into the mix, let alone things that are common and thus expected, but are not actually mandatory from a legal viewpoint. It is complicated. I find it helpful to think of it like a pyramid shape, with the aged care standards on the base of the pyramid and the award or EBA on the next layer. Then you have a combination of state long service leave and workers' compensation legislation, followed by individual arrangements on top. The key to this is that you can't opt out of base obligations purely by increasing other entitlements and remain compliant. For example, an organisation cannot choose to pay a higher rate of pay than is required, but negotiate out of items like national employment standards, such as the provision of 4 weeks annual leave per annum. In my role, I get to work with many providers, thus seeing the internal operations of a wide number of those. Too often I meet people who are so scared of compliance that they're frozen in place whenever anyone mentions a new way of working on anything. I call it sucking air through teeth, followed by, in an admonishing tone, what will the department think? It's usually like, ooh, how will that work with the Act? What will the department think of that? And it is this inactivity that they have evidence to the evidence for the evidence, creating a mountain of unnecessary workload for themselves and others, and never develop better processes to meet their own compliance. Here at ACDM, we have an advisory board of industry professionals, CEOs, directors of nursing, facility managers, HR managers, etc. Some of them are also auditors for the department. So we run everything by them and take your comments back to them if we ever feel we've missed something. The most common replies to us are: 1, the Act does not actually say anything on this topic, and 2, we, the auditors, as the enforcers of the Act, encourage any innovation that helps providers to achieve compliance. Unfortunately, that's not the reality when I speak to people in the field. They don't understand that they hide behind the Act or hide behind what the department might do. Now, how do you ensure compliance? It all comes down to building a quality team. Like any business, outcomes are a reflection of the team delivering them. A laid back, she'll be right, mate approach to operations will result in a lack of urgency and proactivity about service delivery, and ultimately will affect the quality of your entire operation. An autocratic approach, without regard to employees or their stakeholders, will not deliver the high levels of customer service to your residents that you seek in today's market. As I said, I've worked with over 100 facilities over the past 7 years. Some feel like a tight-knit family, and some can only be described as belligerent. Somewhere between those two extremes is a place where teams deliver a quality service to their clients, and the HR department provides relevant information to management so they can make informed decisions on operational tasks. In building or managing a quality team, it can be difficult to find quality staff. This is not only often because of the candidates themselves, but because of common errors they made in the hiring process. It's impossible to build a quality team without getting the first step of recruiting the best people right. Too frequently, I'm called in to meet with a facility manager after they've recruited a group of carers. When they needed to replace 2 carers, they were too busy, so it got put off a while. Then 3 more carers left, so they placed an ad on Seek for 5 carers. But by the time they had set up the interviews, they needed 8 carers. So the first 8 people with a pulse and a Cert 3 in aged care that walked through the door got a job. That's not how it's meant to happen. Let's quickly look at how do you build a team. Hiring for length of work experience, not attitude. Over 70% of organisations I speak to hire staff based on their length of work experience in aged care and not their attitude. So great attitude, but new to the sector doesn't get a chance. So we lose them from the sector. Problem number 2 is understand company or facility culture. Too often the bigger picture is overlooked when selecting a person for their immediate skill set or experience. Long-term retention is directly related to how happy people are in the work environment, and that often means how aligned they are with company goals, values, and culture. The culture plays a much greater part than most of us give it credit for in aged care. How an individual team communicates both within the team and to the other teams can affect the morale of the wider employee population. Mentoring is a technique that has been used successfully by many organisations to transfer knowledge and challenge the status quo. Your workers should be encouraged to network with each other and expand their circle, especially in finding a more experienced worker, perhaps a carer who's become a team leader or is now studying nursing, for them to emulate. Lack of customer service mindset. The modern aged care facility is meant to be completely driven by client service ethic and a total focus on servicing the customer. This sector is closer to hospitality than healthcare, yet many people do not understand that the residents pay money to live at your home. They are entitled to customer service. The final problem is not incorporating a personal development plan from the start. A key success factor to any long-term hire is to outline a clear plan for the individual's personal development from the very start of their employment. Eric Bock, a US educator, once famously said, "If you think education is expensive, try ignorance." This is more than true for the aged care sector. An uneducated or belligerent support worker or team can cause much damage, both from a risk and financial perspective. Other than formal qualifications, ongoing training is essential to allowing your team to facilitate continuous improvement in the day-to-day operations of the home, let alone keeping abreast of changes in clinical practice in Australia. In terms of building a bulletproof team, the number one objective is to employ people in your organisation that are always looking to improve. They should always be considering how to improve their function as well as their own professional development. So as I said, compliance and efficiency are the two keys to making the three work. But the third set which works with them is capability. And this is one which I find commonly gets overlooked. As I said, one thing that's often overlooked in assessing carer function is an understanding of the team's capability. This is a combination of the skills, experience, and problem-solving ability by the members of the team. Without this, it is difficult to plan a strategy for that your workers can deliver value to your organisation. Therefore, it is critically important to understand the current capability of your teams. Historically, this has been very difficult to measure and therefore manage, as aged care is not known for tracking big data. Essential to understanding capability is the often misunderstood myth that experience equals knowledge or capability. This couldn't be further from the truth. I've seen many people with only a few years' experience in aged care having much more knowledge and capability than their more senior colleagues. A person can claim to have 20 years' experience, and of course it sounds impressive. But is 20 years' experience the same as 1 year's experience repeated 20 times? Worse than that, are the same techniques, clinical practice, processes, and service being delivered as they were 20 years ago? I think there's a vast difference. It's the difference between someone working as an entry-level carer versus a problem-solving, value-adding, clinical, customer service-focused professional. Two are completely different and provide remarkably different outcomes. So, how do you build capability? Two key areas that I keep seeing: qualifications and training, and technology. With education, it's important not to see the Certificate 3 in aged care as the start and finish of education in aged care. It's important that workers have the opportunity to grow, not just for skills, but also in attitude, and as a demonstration that they are valued by their employer. Without demonstrating that value and the opportunity to grow in the role, why are you surprised when you have higher staff turnover than desired? It's important to not only have continuous professional development for the team, but also a continuous improvement program for your processes. The best use of someone who has completed their Cert 4 in aged care, disability, leisure and health, etc., is a project to work on improving the facility. There's no extra money or rank involved, but you're recognizing their commitment to growing themselves. So they are happy for the recognition, and you reap the benefits of a set of enthusiastic eyes reviewing wherever you direct their attention. It's a win-win scenario. Technology is in-house, hosted, outsourced, cloud, integrated, offshored, software as a service, business processing as a service, and BPO, business processing offshore. Just getting across the jargon and acronyms is difficult enough without having to try and understand which technology is best for your requirements. I'm often asked by people what the best systems are. The answer is it depends. As unhelpful as that is, the best platforms are the most appropriate to your specific requirements. That is why we built the CareHQ marketplace. There are a variety of different service providers in there covering HRIS, payroll, rostering, police checks, medical checks, reference checks, so that you can mix and match your needs, including incorporating any legacy platforms that you have in place. Last year at the ITAC conference, IT and Aged Care, our CTO and I talked to almost every technology provider in attendance. Only 40% of the platforms had the capability of exporting data, and half of those were old technology, so not much more than manually exporting a CSV file and having the other platform import the file. That is not the level of technology you should be demanding in 2017. Again, go back to the CareHQ marketplace and have a look, because all the providers there have developed API-driven gateways that allow for real-time sharing of data. Not everyone is fully there yet, but they're developing it, and we can help you navigate that minefield. The one thing is for certain, the devil is in the detail. If you don't communicate the detail to potential vendors, you may be on the receiving end of one of my most hated sentences. Well, that's just how the software does it. One of the most common mistakes I see in configuring new HR technology platform is an organization trying to replicate the old. There may be a good reason to change the technology, but there's only a focus on the compelling event or change or adding the technology, and little thought to process improvement, or at the very least questioning why you do things the way you do them. There's a whole lot more we can do on technology, but we don't have that we don't have that kind of time in this webinar. So please look out for another webinar I'll be holding in the next few months on finding the best technology for your organization. That's the end of the overview of the intersection strategy. My aim with the webinar was showing you the correlation of people, processes, and technology in workforce management, because in so many aged and community care providers, they're all managed by different departments who don't work together very much. So that's a challenge when all three key areas need to be in line. I also wanted to give you some ideas to go away and look at in your organizations around efficiency and compliance and capability and how they intersect. Your time is precious, and I really aim to give you value, and thanks for giving me 50 minutes of your time. I hope you feel like it was a good investment of your time. Everyone who is online now will be receiving a pack of Talking the Talk booklets from me for their staff. They are only little, very uncool, but they are very powerful. Seriously. We get phone calls from all over the place asking for copies of this booklet. Last year I had a call from one of the nurses stationed at one of the big Melbourne hospitals saying they'd lost our book. I didn't actually know what they were talking about at the start because we don't work in the acute sector. I ended up charging them $5 a booklet and sent them a box of 100 booklets. So they're a very handy tool for staff at all levels. We're getting a new set printed over the next few weeks, and I'll send a bunch out to each of you. Now, where do we go from here? As I said at the start, I want to provide you with options on how you can get support in these areas. It might be different service support, technology service providers. There might be different areas of workforce management where you need some support. Having worked with over 100 providers over the last 7 years, I've found that when people want to meet me, they appreciate some ideas and a plan pretty quickly. So let me tell you about the discovery sessions for managers. The aim of a discovery session is a 1-hour session to analyze how we can optimize your workplace around workforce management. Over that hour, I employ the intersection strategy, and we go broad over your organization to get the context and backtrack, deep diving into specific areas that are causing challenges for you or that you're seeking options in. We discuss where the organization is now and where you want to take it. I then go away and create a tailored report using the information gathered on your situation, including the contact details of all of the parties I discuss in my report. So if you want to hit the ground running with the report, everything is in there for you. Now that's a regular discovery session, but as you have supported me by attending only my second webinar, I want to say thank you. These aren't easy to put on. I appreciate your belief in me. Therefore, I'll up the ante of the discovery session. On top of writing the report, I'll present to your CEO and the board or executive team for you at no extra charge. Answer all their questions and the hard stares. And all of that for $247. Seriously, how much would your usual aged care consultant charge you for an hour teleconference? 2 hours to write the report plus an additional hour presenting to the CEO and board. So a total of 4 or more hours. Be over $1,000 if not higher. In addition, I'll give you my personal mobile so that you can all call me for strategic advice in this area for the next 6 months. Again, at no extra charge. And to make it completely risk-free, I'll offer a 60-day money-back guarantee. If you do not honestly believe that you've received value for money, send the report back to me and I'll refund the entire $247. I've never had anyone do it, never anyone take me up on that, so I'm quite confident in putting that out there. To take advantage of this offer, please email me at the email address listed. And please understand that you need to book this no later than 1 p.m. next Tuesday, a week from today, to receive all of the additional value. After that, it's still a great opportunity. It's just the regular discovery session, but you lose out on the CEO board presentation plus the 6 months of strategic advice at no extra cost. Seriously, as it's all under a 60-day money-back guarantee, it is not a cost to you, it is an investment. This plan will save you thousands of dollars in the long term. So please shoot me an email right now and book yourself a discovery session. Right, well, everyone is doing that. I'll start a Q&A session. Please use the chat function on the side or bottom of your screen and type out any questions or comments you have, and I shall do my best to answer them for you. Okay, first question coming through. You're welcome. Comment, not question. Okay. Are there any questions about the intersection strategy, technology, capability, anything I've touched on? Questions about the discovery session? Give it another 30 seconds in case anyone wants to add to that. Oh, it's a lovely sunny day in Melbourne. I think it's quite hot now. No questions asked. Thank you. I'll reach out to you, Alan, anyway, and learn more about Absolute. That'd be good. As I said on the website, we have as I said in the email, we have on our website a postword list, different agencies and other talent management services. I'd like to make sure everyone has got all their information out there. Anything else? Just keep putting it in. Rural relation with staff retention. Yes, Marie, I've worked with a number of regional Victorian facilities that they say, we don't have a retention problem, we have an engagement problem. In fact, I'd like to get rid of some of my staff. And there was a report just the other day, headed up by Connect West, I think it is, or Caring West, about how in many country towns it's hard to actually find staff, let alone be able to get quality staff. It is a challenge. What we're trying to do is actually bring, it's no good at just an individual facility level, it's more of a group level, but be able to actually, the others have dropped off, Marie, so they're not listening to this. I might give you a call on this and we can have an offline conversation for it. Does that work for you? All right, so I'll move to just saying thank you very much for attending, and I'll be in contact with everyone so that I can go through any particular problems at their facilities. I'll call you soon. Bye bye.